Mary Immaculate Hospital's Patient's Guide to Shoulder Replacement Surgery. Welcome to our virtual shoulder replacement seminar. My name is Debbie, and I'm your nurse navigator. I want to thank you for choosing Mary Immaculate Hospital to help restore you to a higher quality of living after your shoulder replacement surgery. This presentation will help to outline the surgical process from getting ready for surgery to recovering at home, providing clear expectations regarding your orthopedic care. You play a key role in ensuring a successful recovery, and our goal is to involve you in your treatment through each step of the program. Your education and compliance will help to ensure a safe and successful surgical outcome. Please feel free to email me or call me if you have any questions. Pre-Operative Education Book. All the information presented in this seminar can be found in the Get Ready for Shoulder Replacement Surgery Pre-Op book. If you did not get a copy of this book from your surgeon's office, please click the link right below this seminar and you can download a copy of the book. If you'd like, you can follow along in the book as we go through this seminar. But please read the book as there's more information in the book than presented in the seminar. Fill out the survey. When you have completed the seminar, please go back out and click Complete the Survey and fill out the survey. I will get a copy of the survey, and through the survey you can ask me questions if any of the information presented is not clear. I will either send you an email or I will give you a phone call. About your surgery. You will find general information about your shoulder replacement surgery in the book and in this seminar. Please speak with your surgeon for more detailed information about your specific surgery. Pre-operative testing. Once you and your orthopedic surgeon have agreed that surgery is the best option for you, your surgeon's office will send information to our pre-anesthesia testing department regarding your surgical procedure. From here, you will be scheduled for a pre-operative nursing interview. You will receive a phone call from our pre-anesthesia testing staff before your surgery to schedule your nursing interview. During this important scheduled time with the PAT nurse, you will be asked to share your medical history, surgical history, allergies to both foods and medications, and your daily medications, to include vitamins, herbal supplements, and anything over the counter, topical or oral. Be sure to have the bottles available for this interview so that you can provide the medication name, dosage, and how often you take it. Your personal medical history will determine what preoperative testing you will need before surgery. While your nursing interview must be scheduled, your medical tests may be completed without an appointment. Please do this within 30 days of surgery. Common tests include lab work, which is non-fasting, meaning you can eat prior to the lab draw, an EKG, a chest x-ray, and a urinalysis. The results of your test will be sent to your surgeon and you will be contacted if the test results are abnormal. It is also best to undergo a complete physical examination with your family physician within 30 days of surgery. Your surgeon will let you know if this is a requirement for surgery. If you have any high-risk medical conditions or see a specialty doctor, you may be required to obtain surgical clearance from these physicians. Medications. During your scheduled PAT interview, a nurse will go over with you what medications to stop, when to stop them, and what medications you can keep taking as you wait for surgery. Please make sure that you have a piece of paper and a pencil so you can write down this information, as it's easy to get overwhelmed as you wait for surgery. Herbal supplements and over-the-counter vitamins need to be stopped 14 days before surgery. Non-steroidal anti-inflammatories, also known as NSAIDs, need to be stopped 10 days prior to surgery as they thin your blood out. You can find examples of NSAIDs in your pre-operative book. Anticoagulants, also known as blood thinners, and diabetic medication. Please speak with your surgeon and prescribing physician for instructions on when to stop these medications and what to do as you wait for surgery. Daily medications. Again, please have a piece of paper and pencil handy as you go over this information with your PAT nurse so you don't forget what they instruct you to do. Pain medications. You can keep taking the following pain medications as you wait for surgery. Tylenol, also known as Acetaminophen, oxycodone, Percocet, hydrocodone, Vicodin, Norco, Tramadol. Again, if you have any questions, please call our pre-anesthesia testing department at 757-886-6640. Preparing for surgery. Start by picking a coach. It can be a friend or a family member, but should be someone who can help you for the first few days after you return home from the hospital. Have your coach watch this video and read the preoperative book so they can help you stay on track as you get ready for surgery. Stop smoking. Smoking increases your risk of lung complications during and after surgery and decreases your ability to heal. If you aren't ready to stop smoking, please try to cut back at least 2 weeks prior to surgery, and don't smoke the night before or the morning of surgery. Stop alcohol intake, or at a minimum, limit your alcohol intake at least 2 weeks before surgery. After surgery, please check with your surgeon before you resume drinking alcohol. Eating healthy. Proper nutrition is an important part of healing. Maintaining a healthy diet decreases the risk of heart disease, high blood pressure, and diabetes. Prepare and freeze or purchase small portioned healthy meals for times you may be alone. Create a safe home environment. Make sure that you put night lights up in dark areas, that you check to make sure that there are no throw rugs or cords that will be in your way. Make sure you check your hand railings on steps to make sure they're secure, or you may want to have them installed. Please stay active. The more active you are before surgery, the better your recovery will be after surgery. Make sure to buy these things and have them on hand before surgery. Stool softeners. You'll need to take those when you get home to prevent constipation. Protein supplements. You can pick any kind of protein supplement, but it's important to get protein in as you heal after surgery. Ice packs. Ice is very helpful after surgery for pain control to decrease swelling. COVID testing. Mary Immaculate Hospital's COVID testing policy is constantly changing based on the CDC guidelines. Please contact your surgeon's office or our pre-anesthesia testing department at 757-886-6411 if you have any questions. Cleaning your skin 3 nights before surgery. You should get your CHG bathing solution from our registration department when you come for your pre-operative testing. If you did not get the CHG bathing solution, please call our pre-anesthesia testing department at 757-886-6411 to find out where you can get this solution from. Going home after shoulder replacement surgery. Your surgeon may be planning to send you home on the day of surgery. Ask your surgeon if you will be going home the day of surgery or staying overnight. Items to bring with you to the hospital the day of surgery include your CPAP machine, your glasses case, and your denture case. Countdown to surgery. Please refer to your preoperative education book as there's a more detailed information about what you should do as you get ready for surgery, but I wanted to point out a few things. 4 weeks before surgery, make sure you schedule your preoperative physical. 10 to 14 days before surgery, make sure you stop medications as instructed by your physician or a pre-anesthesia testing nurse. Stop or cut back on alcohol intake and smoking. 3 nights before surgery, start your skin preparation using the CHG solution. The day before surgery, make sure you drink plenty of fluids and you eat a snack before you go to bed. Remember, nothing to eat or drink after midnight. The morning of surgery, again, remember, do not eat or drink anything, except you can take a sip of water with any medications you're instructed to take. And it's safe to brush your teeth. Where and when to come the day of surgery. Your surgeon's scheduler will call you a day or two before surgery and let you know where to come and what time to come to Mary Immaculate Hospital for surgery. You'll find instructions and a map in the back of your preoperative book on where to come the day of surgery. Pre-op area. After you check in with registration, you'll be taken back to your pre-op room where you'll wipe off with CHG wipes and your nose will be swabbed with a nasal antiseptic. You'll put on a hospital gown and then they'll put a warming blanket on you. All of this is to help prevent infection after surgery. Your vital signs will be checked. Your medical and surgical history will be reviewed along with your medications, but do not bring any medications with you the day of surgery. We'll start an IV. You will meet with your surgeon and your anesthesia care team. You will also get any medications such as antibiotics and fluids that your surgeon or your anesthesia care team wants you to have before surgery. Anesthesia information. You will meet your anesthesia care team, which consists of an anesthesiologist and your nurse anesthetist. They are responsible for your comfort and well-being before, during, and immediately after your surgery. They will meet with you before surgery to discuss your anesthesia plan for the day based on your history, medications, and personal needs. Decisions regarding the type of anesthetic, gases, and medications used will be made by your anesthesia care team. Please make sure to let them know if you've had any problems with anesthesia in the past, especially if you get easily nauseated or have trouble urinating. General anesthesia. General anesthesia will be used for your shoulder replacement surgery. Your anesthesia care team will put you to sleep using an anesthetic gas. Once you're asleep, they will insert a tube into your mouth and lungs to breathe for you while you are sleeping during surgery. They will give you medications through your IV during surgery to help prevent nausea, pain, and to make sure you remain asleep until your surgery is done. With this type of anesthesia, you will be unconscious throughout your surgery. As you awaken, you will be taken to the PACU, or also known as the recovery room. Interscalene nerve block. A nerve block is an injection of a local anesthetic onto or near a nerve for temporary pain control. The block is a single injection performed near the base of the neck and into the group of nerves that supplies the affected arm. It is a sensory and motor block, meaning you will not be able to move or feel your arm after the injection. This block will be provided so that you have pain relief for 6 to 12 hours after surgery. Exparel. This medication or a similar alternative is injected into the tissue around the joint during surgery to help provide pain management for 12 to 24 hours after surgery. Post-Anesthesia Care Unit, also known as the PACU. Once your surgery is over and you start to wake up, you will be taken to the PACU, also called the recovery room, where you will continue to be under the care of your anesthesia team. Your vital signs will be observed closely as the effects of anesthesia begin to wear off. Early on, you may feel sleepy, dizzy, or even a little confused. It's not unusual to be groggy for the remainder of the day. After you have been deemed stable by your anesthesia care team, you will be moved from the PACU to a room where you will continue to recover under the direction of your surgeon and our nursing staff. If you're spending the night, you will be moved to an inpatient hospital room. If you are going home the day of surgery, you will be taken to our Phase 2 discharge unit. Make sure if you're going home the day of surgery that you have someone arranged to stay with you for the first 24 hours because of the impact of anesthesia. What to expect after shoulder replacement surgery. Pain management. Pain is a normal part of shoulder replacement surgery. Your care team will work with you to help you have pain tolerance. Pain tolerance means you can change positions, walk, dress, bathe, and go to the bathroom even though you have pain. Please set realistic expectations for yourself so you do not get frustrated after surgery. Yes, you will hurt and you will be uncomfortable. Besides pain medication, some things you can do to help with pain after shoulder replacement surgery are use lots of ice, change positions so you don't get stiff and sore, distract your brain so you don't think about the pain, and get up and move and walk to help prevent complications. Ankle pumping and support stockings. You will want to rotate your ankles or move your feet up and down 10 times an hour to promote circulation and prevent blood clots. If you wake up with white support hose on both your legs, then you'll be expected to wear those at home. You can take them off at night, wash them, hang them up to dry, and put them on the next day, but keep wearing them until your surgeon instructs you to stop. Incentive spirometer. You'll be using an incentive spirometer here and at home 10 times an hour. This encourages you to take deep breaths so that you don't develop pneumonia or run a fever. Arm sling. Until your arm fully wakes up, you will need to keep the arm sling on to prevent your arm from dropping. Once your arm is fully awake, please follow your surgeon's instructions on when and for how long to wear the arm sling. Make sure that you eat a snack before you take any medications. Again, that you get up and walk. And also, please read your discharge instructions as there's more detailed information from your surgeon on what you should be doing during your recovery. Medication review. While in the hospital and at home, you will receive different medications, so let's review them. Pain medication. Your surgeon will choose the pain medications that are appropriate for you as you recover for shoulder replacement surgery. Please read the insert so that you know what you're taking and how often to take it. If you run low on your pain medication, make sure that you call your surgeon's office to get the prescription refilled. If your prescription narcotic is not working, please also call your surgeon's office to discuss this with your surgeon's care team. Stool softeners. You'll need to purchase an over-the-counter stool softener and start taking that the day you get home from surgery, as narcotics and anesthesia are very constipating. Home medications. Your surgeon will let you know what medications to resume when you get home and which ones to continue not taking. If you happen to spend a night in the hospital, their care team here will provide you your regular medications until you go home. Outpatient pharmacy. You will be provided with the opportunity to fill your medications at our outpatient pharmacy located in our medical pavilion. If you prefer to fill your prescriptions at your home pharmacy, please make sure that you have this conversation with your surgeon the morning of surgery so that they send your medications to your home pharmacy if that's what you choose. Please note that filling your prescriptions at our outpatient pharmacy does not obligate you to have refills done here, and we have it available for your convenience so that you can pick up your medication and have it before you go home. Preventable complications. Blood clots. The best way to prevent blood clots is to get up and walk, change positions, and rotate your ankles and rotate your hand and your wrist. Constipation. The best way to handle constipation is to take a stool softener and/or a mild laxative and drink plenty of water. If your bowels do not move within 2 days of surgery, please make sure that you take more medication and drink more water. Pneumonia. Pneumonia is preventable by taking deep breaths and using your incentive spirometer and, of course, getting up and walking short distances every hour. Infection. Please keep your incision clean and dry. Read your discharge paperwork to understand how to manage your dressing. Shower as directed by your surgeon, and it's always important to do good hand washing. For warning signs of blood clots or infection, please refer to pages 26 and 27 in your pre-op book. Tylenol, also known as acetaminophen for pain. Remember, about 10 days before surgery, you'll be asked to stop any NSAIDs you might be taking that are helping with your shoulder pain. Many patients want to know what they can take for pain as they wait for surgery. You can safely take Tylenol or Acetaminophen for pain. It's best to take 1 extra strength Tylenol every 4 hours or 2 every 8 hours. If you have Tylenol arthritis, you can take 1 pill every 6 hours. If you're on a narcotic, please check in your preoperative book for a list of medications that are narcotics that contain Tylenol, as you do not want to take more than 4,000 milligrams of Tylenol in a 24-hour period. Thank you for choosing Mary Immaculate Hospital to have your shoulder replacement surgery. We look forward to helping you on the road to recovery. Please feel free to email me or call me if you have any questions or would like to review any of the information provided in this seminar or located in your preoperative book. Remember, after you close out the seminar, please go out and fill out the survey. Again, thank you and have a wonderful day.